Oops. Sona Jai Shri Krishna, Jai Jinendra, Jai Swaminarayan, Sairam, and good evening, everyone, and a very warm welcome to you all. On behalf of GAA London, I would like to thank you for joining us today for our community health webinar on the importance of good posture. No slouching. In our daily lives, many of us spend long hours sitting at desks, using computers, or looking at our phones. Over the time, these habits can affect our posture and may lead to discomfort, back pain, or other health issues. Understanding how posture affects our body and learning simple ways to improve and can make a big difference to our long-term health and well-being. So today, we are very pleased to have with us Dr. Xander van der Walt, a qualified chiropractor who has been practicing since 2008, and he's been with us for the past 3 weeks. And during today's session, Dr. Xander will be covering several important topics, including the anatomy of the spine, what good posture really means, common postural distortions that develops from childhood through adulthood, the causes of poor posture and how we can correct them, the impact of poor posture on our health. At the end of the presentations, we will also have a Q&A sessions, so please feel free to note down your questions in the chat box and we can catch up. We are very grateful to Dr. Xander for giving his time to share his knowledge with our community today. So without any further delay, I would like to invite Dr. Xander to begin the session. Dr. Xander, all over to you. Looking for you. Got you.
Can
All
you hear me?
yours.
Can you hear me?
Yes, we can hear you.
Perfect. Well, thank you again for the introduction. Thank you again for having me. And welcome to everyone. I see some familiar faces. So, as we mentioned, we'll talk about the importance of posture this evening, because posture has a direct link to your health, and I'll explain, obviously, throughout why posture is so important and why maintaining good posture is so. Yes.
Can you just pull your screen towards you so you look higher because only your face is showing?
Is that okay?
Yeah, better. Thank you.
You're welcome. Yes, as I was saying, we'll talk about the importance of posture, why posture is so important, and some simple things you can take away from this evening. Uh, I welcome, obviously, questions at the end. If I can answer them, hopefully I will be able to. If not, I will always try and give you an answer either via email if we can do that next time, maybe. But yeah, please take some notes. It's going to be a lot of information. Apologies if I go too quickly. I'll try and have about an hour or so. So thank you again for coming, and let's get started. Okay, so can everyone see my screen?
Yes, we can.
Perfect. Okay, so in terms of what our health encompasses, health by definition is related to your emotions, your biochemistry, basically how you use food and other nutrients to maintain the function and health of your body, but also related to this evening is actually related to your physical structure. So that is why maintaining a healthy, good posture throughout your lifetime is so extremely important. There is a study I always reference. There was a study published a few years ago. They followed basically, they divided people in four groups. Group one had the best posture, and group four had the worst posture. What they found is that people in group four who had the worst posture compared to people in group one, they had a 393% increased chance of disability. So that is how important it is obviously to make sure that you maintain good posture. So that's why this evening's talk is going to be so important, because maintaining good posture throughout your lifetime is extremely important for your overall health and well-being. And posture actually impacts how well your brain functions, which I'll explain later on. So for those of you who've been to my previous talks, remember everything in your body is controlled by your nervous system. Your nervous system is your brain, your spinal cord, and the nerve roots controlling every cell, tissue, organ system in your body. Your spine, which is your physical structure, protects the system which regulates and controls every system in your body. So if your nervous system is protected by your spine, how important do you think it is to maintain a healthy spine and a healthy posture? Extremely important. Your muscles, which is the scaffolding around your spine and obviously your body, which helps with movement, is also then controlled by your brain. So when the spine does not move properly, that means your brain cannot control your muscles properly. And that is over time one of the reasons how you develop postural distortions. So as I mentioned, your nervous system controls your muscles and your ligaments and your tendons, which obviously are very important structurally to maintain healthy posture. Okay. Your spine is the motor which drives your brain. So when your spine is healthy, your brain is healthy. Now, when we talk about posture, a lot of people just think the basic things, sitting posture, standing posture, sleeping posture. So yes, that is correct. However, there are hundreds of different postures that we adopt and use every single day. So if we divide those postures into sitting posture, sleeping posture, walking posture, etc. Like I said, I'll be here all night discussing all the different types of posture. So for now, we're just going to talk about the basic ones. So first of all, we have sitting posture. When you sit, we place about 300 pounds of pressure on your lower discs in your back. Now, the discs in your spine, they are about 80% water. When you sit, they will get compressed. Now, over time, because the spine doesn't move, one of the reasons why the discs dehydrate and degenerate is through a lack of spinal movement. So that is how, over time, you or people might shrink because you develop postural distortions, muscle tension, scar tissue, and then obviously you can develop postural distortions and you can shrink. If you measure yourself in the morning, generally speaking, you will be taller compared to when you measure yourself in the evening, because throughout the day, the discs will slightly dehydrate. So, for those of you who sit for long periods of time, it's very important that you stand up on a regular basis for your circulation, for your muscles, for your heart, and for the benefit of your discs and your spine. So, ideally, when you're sitting, you should sit with a lumbar or a low back support. So you can buy ones on Amazon, or you can just take a towel or a cushion and place that in your low back. Your hips and your knees should be at 90 degrees, ideally. So there are things like a footrest that you can purchase that will help if your chair is possibly a bit too high. Otherwise, you can put a book or a couple of books in here to get your hips and your knees at 90 degrees. Your chin should be tucked backwards in line with the shoulder. When the head goes forward, it puts more of a stress on the brain stem, which is the back part of the brain, and also on a lot of your postural muscles. In terms of chairs, I've touched on upon last week, I think, a good chairs. So a good ergonomic chair is very important, especially for those who are going to be sitting for long periods of time. Otherwise, you can purchase things like a saddle chair. So a saddle chairs basically looks like a horse's saddle. Now, with those, they are good because you don't have a back support, but they get you to sit upright in a fairly relaxed position rather than having a chair like this. And then after a while, you start getting comfortable, so you start leaning backwards. Now, the problem is when you lean backwards, your pelvis is going to tilt backwards. And when your pelvis tilts backwards, those discs in your lower back, they can start bulging backwards. And over time, that can lead to disc bulges. And you don't want that because if the disc bulges backwards, that's where your spinal cord is. And your spinal cord is what your brain uses to control everything in and out of the body. So the body sends information in the spinal cord back to the brain, brain sends information down the spinal cord through the nerves to your body. So that's why sitting posture is so important. You should be taking a break from your desk or from wherever you're going to be sitting if you can every 15 to 20 minutes, please. Now, next thing is going from sitting to standing. So anyone know which are the strongest muscle groups in your body? Any guesses? Your thigh muscles or your quadriceps, these muscle groups. So why not use them properly? So when you stand, move towards the edge of your chair, lean slightly forward. If you want to, you can place your hands on top of your thighs, and then basically your center of gravity is going to go forward and then push yourself up with your leg muscles, keeping your back straight. Okay. So that's how ideally you should be going up from a sitting to standing position. Next thing is your lifting posture. Most of you hopefully will have heard you should lift and bend from your knees, but a lot of times you're not told why that is. So the way that I would explain it to my patients is if you were to stand up and bend forward to pick up a box or whatever it is, your low back muscles do not get engaged fully because what happens is your brain tells you or estimates that, okay, I'm picking up this box. So this box, I know what's in the box or I don't know what's in the box. So let's say okay, the box maybe weighs 20 pounds or 10 kilos. When you bend forward, your brain then uses whichever muscles it thinks are appropriate to lift the box, but it doesn't engage your core fully. And obviously, your core muscles include these low back muscles. So your brain is picking up potentially 20 pounds of weight, but it's not calculating picking up your upper body weight as well, because those muscles in your low back have to act like levers to pull up your upper body weight. But your brain is only telling you to activate by picking up 20 pounds. So that's why you should always bend your knees and try and keep a straight back and then lift yourself up and bring the load close to your body. Next, we have your sleeping posture. So sleeping posture ideally should be in the fetal position with the knees bent and a pillow between the knees. You should also have ideally a contoured pillow. So a contoured pillow is basically going to be a pillow that looks like a wave. That will keep your neck straight, keep the spine straight, whereas the pillow between the knees, it will stop you from rotating the pelvis around. Or line your back with your body straight, but place a pillow underneath your knees because that will take some strain off the spinal cord. Never sleep on your front. When you sleep on your front, you're compressing your rib cage. You're pushing, well, basically your upper body weight has to be lifted up by your rib cage. You're compressing your heart, you're compressing your lungs. Your pelvis tilts forward, putting even more stress and pressure on that area. And if you've been sitting all day, every day, that's not a good thing. And the other thing is obviously you have to breathe. So you can't breathe by keeping your neck straight, so you have to rotate your head. And if you keep rotating your head, that causes problems with your upper neck. And once there's a problem with that part of the head, that's not a good thing, which I'll get to later on. Your sitting position is slightly more relevant for ladies. If you are going to sit cross-legged, please make sure that you get in the habit of swapping sides. Because if you place one leg over the other, your pelvis is going to rotate around. And over time, if you keep doing that, it gets stuck in that position. So always make sure you alternate sides. For guys, please don't carry your wallet in your back pocket because as soon as you sit, it creates an imbalance. So rather than sitting straight, you create an imbalance because the pelvis is going to lift up. So you put more weight on the other side. So that's another cause for pelvic imbalances. If we consider what good posture looks like, if you look at your spine from the side, you've got 7 joints in your neck, 12 in your middle back or your thoracic spine, and then 5 in your lower back or your lumbar spine. This is your pelvis. Your hips would sit on either side. And then we have the sacrum and then the coccyx or the tailbone. So your spine should have 3 natural curves. The neck curve is very important because it's there to hold the weight of the head. When we get forward head posture, over time, it can lead to a straightening out of that neck curve. When the neck curve straightens out, that's a big serious problem because then the spinal cord, which sits inside the spine and ends all the way down to about this region, that gets stretched by between 5 to 7 centimeters and it causes disease. So that is how important it is to keep healthy, good posture to make sure over time you don't develop degenerative changes in the spine. So if you look at your posture or someone's posture from the side, what we're looking for is for the ear to be in line with the shoulder, in line with the hip, the knee, and the ankle. So that is perfect posture from the side. Okay. If you look at posture from the back, again, the head should be level. There should be no tilt. The shoulders should be level. The pelvis should be level. And if you draw a straight line, the body should be equally divided into left and right. So there should be no shift or distortion from the midline. Your pelvis is here. This is the sacrum. This is the coccyx. These joints in here, they are called your sacroiliac joints. Those 2 joints carry 50% of your upper body weight. When your pelvis tilts, so it can tilt down and forward and down, rotate inwards, rotate outwards, tilt and rotate, etc. So that's what chiropractors would assess and correct. Anyway, when we get a pelvic imbalance, it affects how much weight is distributed into those joints. So that could be one of the contributors for developing back pain. Now, as chiropractors, we're trained to take and read X-rays. So, sorry. If we look at low back from the front, this would be the pelvis, the right and the left, and then the spine should be nice and straight. Okay. And then the hip joints sitting nicely inside the sockets of the pelvis. When the pelvis rotates, it does affect the mechanics of the hip joints. So rather than sitting nicely in the groove, it starts to created uneven strain on the hip joints. And over time, that can lead to degenerative changes in the hip joints. When we look at the neck from the side, so that green line is a nice curve you should have, and the head then sitting nicely on that curvature. So as I mentioned earlier, when the head goes into a forward head position over time, it leads to a loss of the curve in the neck. Once that neck is straight, it then starts putting a lot more extra stress, not only on the discs, the spine itself, and the surrounding muscles, but it also stresses the brain. And over time, like I said, the spinal cord gets stressed and irritated because it's getting stretched by 5 to 7 centimeters. Unfortunately, because of the use of these, I have never seen as many children and teenagers now with postural distortions and scoliosis, etc. And from my experience, like I said, using smartphones and tablets and things like that is probably the biggest contributing factor. So please, for those of you who do have young kids, minimize screen time as much as possible. Now, no muscle in your body works without your brain telling it to work. That comes again down to how well your spine is moving, which comes down to how well your posture is going to be as well. So we have anti-gravity muscles. They are basically there to help with maintaining upright posture, to counterbalance the effect of gravity on your body. So these are your anti-gravity muscles. We have your neck flexors, which are these muscles in the front of the neck, your neck extensors, which are the muscles at the back of the neck, your spinal flexors, your extensors, the psoas, which is the hip flexor muscle, the quadriceps, which is the thigh muscles, your hamstrings, which are these muscles at the back of your thigh, then your calf muscle, and then this tibialis anterior is the muscle in the shin, in this part. Now, muscles work together. If I were to go and flex my elbow, my biceps muscle contracts and my triceps, which is the muscle at the back, it's going to uh, basically get stretched. So if there is an imbalance in these muscles, so for example, if these muscles are tight and these are weak, that is going to be one of the causes for forward head posture. So when we're thinking and talking about rehabilitation, you always have to consider which muscle groups need to be stretched and which muscle groups need to be strengthened. Because if you keep over strengthening or overstretching, again, that is going to contribute to these potential imbalances in the body. Does that make sense? Okay. So we have some postural distortions. So we know what normal is. Now we need to know what abnormal looks like. So a very common presentation I get is probably these two. So we get rounded shoulders and we get the forward head posture. And then we get a tilt in the pelvis. So the pelvic tilt a lot of times is because the hip flexor muscles are tight. So the hip flexor is a muscle which attaches into the sides of your 5 low back joints, and it runs down and attaches on top of the hip. When it contracts, you basically bring your knee up to your chest. So that's the function of that muscle. If it's tight, it's going to pull the pelvis forward. When the pelvis is forward, that then places a lot more extra stress and pressure on your lower back joints, discs, and nerves, and the spinal cord. So if you do have, or if you know anyone who has that pelvic tilt, get them to at least stretch the hip flexor muscle. So how you would do that is a couple of ways. You can do a standing lunge stretch. For those of you who do yoga, you can try and do a pigeon pose, or you can just lie on the side of your bed with one leg dangling off the edge, and then bring the other knee, opposite knee, to your chest, and then just hold that. And if you can hold that for 30 seconds and do maybe 5 sets on each side, that is a good way to stretch the hip flexors. However, you would also then need to consider to strengthen up your buttock muscles and your back extensor muscles. Now, with the rounded shoulders, that's probably the most common presentation alongside the forward head posture. Rounded shoulders, why? Because everyone spends time on the phone, on a tablet, or in front of a computer. So the pec or the chest muscles, they get overdeveloped. As a result of that, they round the shoulders back. So the imbalances normally are the chest muscles and then the rhomboids and the trapezius. So the rhomboids are the muscles between your shoulder blades, which pull your shoulder blades back. So you've got the spine in the middle and then the shoulder blades, and then the rhomboids, which come from the spine and attach into the sides of your shoulder blades. So because the chest muscles or the pec muscles get tight, tight always wins. So tight pulls the shoulders forward. So that's why you have to stretch the chest muscles and strengthen up the rhomboids. So how you do that? Well, you can stand in a door with your arms straight and then just lean forwards. So that will help to open up the chest and start stretching the chest muscles. Then to strengthen up the rhomboids, things like doing flies or rows. So you can use things like dumbbells or exercise bands, and then just basically just hold the dumbbells and pull and squeeze the shoulder blades backwards. But throughout the day, especially if you're going to be working at your desk, work to pull the shoulders back and squeeze the shoulder blades together. And then for the head, it's to make a double chin. Okay. Now, when we look at posture from the back, I've mentioned what normal is. Now, this would be a classic presentation for scoliosis or a curvature in the spine. Now, with a scoliosis, it's either congenital, which is something that you were born with or someone's born with, or something which develops usually around 8, 9, 10, 11 years old. It's more common in girls. So a simple test that you can do, get the person to stand in front of you and touch their toes. What we're looking for is a thing called a rib hump. So a rib hump is where one side of their rib cage is going to be higher compared to the other one. So that is a test that everyone will do. A medical doctor would do it, schools will do it. Just get them to stand barefoot and touch their toes. So if you do notice either muscles being bigger or higher on one side of their spine, or the rib cage being elevated, get them to see a chiropractor as soon as possible. Because if neglected, it's going to get worse. Just because they don't have any pain, it doesn't mean there's not going to be a problem. Now, like I mentioned earlier, there is no muscle in your body which works and contracts and relaxes without your brain telling it so. So these are your postural muscles. Those are the muscles that keep you upright. And these are the nerves which control those muscles. So your accessory nerve is one of the 12 nerves in your brainstem. When you have a problem with the first joint in your neck, which is called C1, it's going to affect the function of those 12 nerves in your brainstem. They're called your cranial nerves. The 11th one is your accessory nerve, which controls your trapezius muscle. Okay. Then the middle 3 nerves in your neck, they control your diaphragm. So diaphragm is in here. Okay. So your diaphragm is not a postural muscle, but it's a core muscle. A lot of people don't realize that. So when people work on their core and they go to the gym and they talk about doing Pilates, fantastic, but you're neglecting breathing. Okay, you should breathe deep exhalations, A, to calm your nervous system, but also to work on strengthening up your diaphragm. Next, we've got the core muscles. So again, no core muscle works without the brain telling it to work. So that's why it's so important to keep your nervous system healthy. And that's where chiropractic comes in. So your core muscles, again, is your trapezius. So that muscle attaches into the back of the head, inserts into your shoulder blades, and then runs down and attaches at T12, which is the last joint in your middle back. Then you've got your QL. So your QL is a muscle that comes from the top of your pelvis, and then it attaches into your last rib. So your 12th rib is going to be about here. So we talked earlier about the importance of your pelvis. When the pelvis would rotate inwards, outwards, drop backwards, tilt forward, then the QL muscle is going to get contracted on one side and stretched on the other side, which is going to impact the ribs, which is going to impact your lung capacity because your rib cage doesn't expand properly because it's stiff on the bottom. So again, that's why maintaining good posture, keeping the pelvis stable is so important as well. And then another overlooked core muscle group is this pelvic floor. So ladies, after giving birth, extremely important to work on your pelvic floor. Guys, pelvic floor strength and stability is extremely important, especially as we get older because of prostate. So how we work on the pelvic floor, it's pretty simple, but it takes practice. So basically you contract your buttocks and you imagine you stopping yourself peeing midstream. So that's how you would engage your pelvic floor muscle groups. So you can do that throughout the day. You can do it sitting, you can do it standing, you can do it walking, you can do it whenever. And then obviously to work on strengthening these, again, it's up to you how you like to do that. Pilates, going to the gym, doing plank is a very good way of engaging most of your core muscles, or things like a balance board. If you're able to go on a balance board, that's very good for balance and coordination, but also it will use and engage all of your core muscles at the same time. So I mentioned about the importance of your diaphragm. So as you can see, your diaphragm sits underneath your rib cage. If it's strong and you're using your diaphragm, then you get nice gliding motion of the rib cage. So everyone should breathe from the diaphragm, not from the chest. People who are chest breathers, they develop tight chest muscles, and that then leads to the rounded shoulders and the forehead posture. So for everyone, please practice breathing from your diaphragm. That's very important. So in terms of, sorry, in terms of using phone, I mentioned the detrimental effects of looking down. Uh, Sorry. If you look straight ahead, your head weight is estimated to weigh a certain amount. Sorry, I need to start from scratch. The further you look down, the heavier your head is going to become. So if we, sorry about this. Okay, I'll have to do it this way. Can everyone still see my screen?
Yes.
Okay. When you look straight ahead, your head is only held by the first vertebra in your neck. The first vertebra in your neck is called the atlas. Atlas as in the Greek god holding the world. That's why it's called the atlas. Now, when you look down, the further you look down, the more of a load it places on this, the brain, the spinal cord getting stretched, etc. So if you look down at a 60-degree angle and your head weighs 5 kilos, your head now weighs 27 kilos, which is that dog sitting on the back of your neck. Long-term forward head posture, pinched nerves, disc herniations, arthritis, and a decrease in your lung capacity. Well, why is lung capacity important? Well, because when you breathe, you get oxygen. When you get oxygen, that goes into your red blood cells, which then takes that oxygen-rich blood to every part of your body. If you have a decreased lung capacity with forward head posture, you get a 30% reduction in your lung capacity. Do you think your body's going to be able to heal and function properly with 70% oxygen rather than 100% oxygen? No. So correct your posture, please. Forward head posture flattens the neck curve, leading to the loss of the curve, which then stretches your spinal cord by that much, which then causes problems. Okay. So we talked earlier about how sitting puts stress on your lower discs. Like I said, if over time these discs start getting dehydrated or they start bulging, it is going to affect your posture because essentially you're going to shrink. Because we go from a nice, fat, plump disc to over time, if things deteriorate, to bone on bone. So you're not going to be tall, you're going to shrink over time, unfortunately. So that's degenerative spinal problems. And it is not old age and it's not wear and tear for reference. I get people in their 20s and 30s, their spine is riddled with arthritis. For people in their 70s and their spine is textbook normal. So when you sit, if you sit for 4 hours, the most commonly disc affected in terms of degeneration is at L45. So that's the second last disc in your back. So I mentioned this last week for those of you who were present. So L45 disc is the most common disc in your low back where you get degenerative changes. So when you sit for 4 hours, that disc shrinks by a statistically significant level, which is the start of degenerative process. However, if you stand up every 15 minutes and try to touch your toes slowly, lean backwards and bend to your left and bend to your right, and then sit back again, there was no change in in the disc height. So please put a timer for your next to you at your desk if you can, to then go to stand up, drink some water, because again, your discs need water to stay hydrated.
Mm.
As chiropractors, what we assess for is a partial dislocation of the spine. It's called a subluxation. A subluxation is where vertebra in the spine becomes dysfunctional, affecting the communication between the brain and the body. So they alter your posture through compensation. When a joint moves out of its normal alignment, it cannot move back by itself. So that joint can move to the left, to the right, tilt backwards, etc. So then what happens is, as the muscles over time, you will start to develop scar tissue. And then also the other thing you have to consider is fascia. Your fascia is a massive connective tissue network connecting bones, organs, basically everything in your body. Think of it like a massive spider web.
Mm.
So that can become quite stiff and rigid over time as well, and that can also cause postural distortions.
Mm.
So when you go for a massage, there are two types of massage areas or types of massage you need to consider. You need to consider a deep tissue massage for the muscles, but also to consider a fascial release massage. You can work on your fascia with things like a massage gun or a foam roller is quite good as well. But again, that's something that you should be doing if you can on a weekly, if not a daily basis. So when that joint doesn't move, Then the joint above and below starts compensating, the muscles start splinting, etc. So your body starts shifting weight away from the area. And then over time, you start to get these global postural distortions. The joints in your spine have a huge amount of receptors which send information to your brain, telling your brain that joint is doing this muscle is doing this, don't do this, etc. If there's a disruption over time, you develop alterations in how those muscles fire information to the brain. And then eventually you start to develop chronic postural changes. So that is how over time your body essentially learns and develops wrong posture. The principle is you know exactly if your lights are on now, you walk around your house because you can see what's going on, because your eyes are telling you, I'm seeing this. You know exactly what a house looks like. You've lived there for years. Excuse me, when the joint in the spine doesn't move, it's like switching the lights off. You know exactly where things are, but your brain doesn't receive the information adequately. So it has to start second guessing. So it has to get information from other sources. So it's the same principle. So it has to start getting information from muscles, soft tissues, ligaments, fascia, etc. They don't have that huge amount of receptors, which the spine has.
Mm.
This is quite cool and quite interesting research. You can think better if you sit straight and stand straight. And your mood and your emotions are better with better posture. I'll leave the slide for a bit. So, last couple of things. How, well, one way we can accurately and consistently assess posture is using software called Posture Screen, which is something I use in my practice. So we take postural photos throughout someone's care plan, but basically the software uses augmented reality so we can accurately assess all of those points which I mentioned earlier. The ear, the shoulder, the hip, the knee, and then from the back, we can therefore, over time, improve posture. I mentioned earlier the atlas. So this is the atlas, which is the first joint in your neck. That holds the world, which is the head. Now, one of the most important nerves in your body is this one. So the accessory nerve is the one I mentioned earlier, which is a nerve which controls your trapezius, which is this big muscle on the back of the head. However, for now, we want to talk about the vagus nerve. So your vagus nerve, it actually sits on top and just in front of that first joint in your neck. Now, when you're looking down, that joint has to tilt forward because obviously the head is tilting forward. If there's stress and pressure on that nerve, over time, what happens is your body develops a low-grade inflammatory response because your body goes into a stress response. So that stress response, first of all, the nerve starts at the back of the brain, in the spine, sorry, in the brainstem, and it goes to each and every one of your organs. So it controls your heart, your intestines, your stomach, your spleen, your pancreas, everything. So that's why it's one of the most, if not the most important nerve in the body. Okay, it sends calming signals to the body, but also sends stress signals to the body. So that's why it's so important to make sure that you're looking straight and you're keeping the spine healthy. to make sure that there's no undue stress and pressure on that vagus nerve. Because how well and how quickly and how well your body is going to be able to be resilient to stress comes down to how well that nerve functions, which again comes down to how good your posture is, especially with having that head back and not having forward head posture. So your brain obviously has different functions. So since we're talking about posture, we're going to talk about your cerebellum, which is this part of the brain. So that part of the brain regulates balance and motor is movement on muscles and is to maintain your posture, controlling your muscle tone and voluntary muscle activity to basically tell your muscles how to function, contract, relax, etc. Okay. And then again, since I'm a chiropractor, I have to talk about how chiropractic improves your posture. So chiropractic adjustments, which we do, it improves the coordination between your arms and your legs. When you keep adjusting the spine, the brain is healthy, it controls your posture, improves your posture. So a single chiropractic adjustment improved the signal from the cortex to the muscle. So cortex is part of the brain to a muscle equivalent to doing 3 weeks worth of strength training. So if your muscles are nice and strong, your framework of your body is nice and strong. Okay. And if your brain is healthy and your muscles are healthy, that means the risk of falling is significantly reduced. And that's about it. I hope everyone learned something. There's any questions now?
Can I ask you a question, please?
Yes.
Spinal stenosis.
Yes.
In the operation written back, can the situation get worse after a few years? Spinal stenosis operation.
Okay. What's the question?
You go through the procedure of getting spinal stenosis to cure the problem, with the problem written again after a few years.
Well, first of all, which level is the stenosis?
Maybe L4 and 5.
Okay. And is it for you or someone you know?
Somebody I know.
Okay. Well, have they had surgery already or not?
Not yet, no.
Okay. No, can't do anything for that, unfortunately.
And the other thing is, can knee hug help you to relieve pressure on L5? Knee hug.
Well, with the stenosis, it depends what's causing the stenosis. If there's a disc bulging backwards, which then is causing the stenosis, then probably the best I can suggest would be IDD therapy. So IDD therapy is basically where you have a specific table, and then the person or practitioner using the table, they will put basically L45 disc bulge, and then the machine or table basically starts to slowly decompress the disc, and that can sometimes help with stenosis if it's a disc related. If the stenosis is because there's a bone spur or arthritis growing backwards into the spinal cord, then no, unfortunately, you won't be able to do anything for that.
Somebody suffering from both spinal stenosis and scoliosis. What happens then?
From
Spinal stenosis and scoliosis got both. Did the operation solve the problem?
I don't know what operation they're thinking of doing. If it's for the scoliosis, it depends on how bad the scoliosis is, because with a scoliosis, depending on the curvature, if it gets to a certain degree, then they would normally consider putting basically two rods, insert that into the spine with screws to basically just screw the spine in place to help for it not to deteriorate. Whereas with the stenosis, again, I can't comment because I'm not a orthopedic consultant or a spinal surgeon. But like I said, I don't know the case, so I don't want to say it's going to help or it's not going to help. All I can say is if it's bad and obviously they considering surgery, I would always recommend, well, first of all, get a second opinion or third opinion. But Stanmore Orthopedic Hospital is the best in terms of any spine related or joint related issues. So I would always recommend to go there at least just to get their opinion.
Lastly, is the neck cracking neck cracking is dangerous. Neck cracking is dangerous.
Well, again, it dangerous in terms of what? So
People have lost senses. They paralyzed from neck downwards. It was that in the newspaper recently.
again, I don't know what the article was about because obviously manipulation can be done by chiropractors, by physiotherapists, by osteopaths, etc. We always do a screening process for all patients. We always do initial consultation, take a full medical history, do a full assessment, and obviously then it's basically just on a case-by-case basis. What I can tell you is the risk of having a serious complication from a neck adjustment usually is about 1 in 1.3 million. But yes, like I said, it is on a case-by-case basis because if the person is taking things like blood thinners like aspirin or heparin or warfarin, then that is usually a contraindication to doing neck adjustments because obviously it's thinning the blood.
Thank you. Thanks a lot. Thank you very much.
You're welcome.
Dr. Xander, that was a wonderful session, a very handful of informations to take. But before we carry on with the questions, Mayuri, just 2 seconds, if I can just ask everybody, like before today's session, how many of us were actually conscious of our posture during the day? Raise your hand or put it in the chat so Dr. Xander can, understands as well. No? Okay, no worries. Mayuri, go ahead.
Doctor, I just wanted to ask you, the spinal twists that we do in yoga.
Yes.
I thought that would affect the angle of the pelvis.
No, they're pretty good to say again.
Can it harm in any way to for a person who's got a spine which is already degenerative?
No, yoga is a fantastic way to keep your spine mobile. But obviously you should always focus on doing if you're able to keep doing all the other exercises, excuse me, not just the side twists. So things like the child pose is a fantastic way to stretch the whole spine, or the cat camel, and then like I said, the pigeon pose for the hip flexors and for your buttock muscles. But yeah, you should always just use common sense and listen to your body. But no, I mean, if you keep doing the same exercise over and over and over again, then yes, it's potentially going to cause some issues. So you should always aim to do a varied program. So for example, if you're doing yoga 3 times a week, then one day you would do maybe full spine. Second day, you'd maybe do some breathing exercises. Third day, you do something else rather than just doing the side twists.
Okay, fine. I forgot the second question when I remember. Thank you for that.
You're welcome.
Thank you. So many of you have replied me. It is true. Yes, everybody is aware of their postures. And there is a question, Dr. Xander. Why is oh, it's gone? Ooh, it's moved. New questions are coming in. That's why it's jumped. So, do postures corrections belt help? If so, any particular brand you recommend?
So one of my biggest concerns with wearing postural supports, it's yes, you'll be more conscious and aware of it, but I don't recommend prolonged use for it because then it causes other issues because obviously your muscles don't function properly, they don't send information properly to the brain. So again, that can lead to other postural problems. So there's not really one particular one I would recommend. I would recommend for people who do lots of heavy lifting to definitely wear a low back or lumbar support. So basically just it has Velcro straps they can fasten around the waist. That will help just to support the spine. Otherwise, it's basically there's just two straps that you can wear either side. You can buy them on Amazon, it's like 10, 15, 20 pounds. But that's just basically to be more conscious and aware of your posture. But like I said, I don't recommend prolonged use of those. There is another medical device which is from a company called Upright Go. So that is a device where you basically it's got basically like a sticker that you would stick between the shoulder blades, or you can wear a neck strap with magnet fastening. And every time you slouch, it basically vibrates a little bit. So that's basically consciously or subconsciously you're starting to retrain your posture. Because it's a medical device, obviously you need to use caution with it. So obviously for those people who have maybe, for example, things like pacemakers or have epilepsy or things like that, you should always consider just speaking with your medical doctor if you're going to use that. And I think it's about 60, 70 pounds or something.
Okay. Before we go to Nalini Ben, there's another question saying, what is Schumann's disease and is there anything one can do to counter it?
Yeah, so Sherman's disease is basically it's juvenile kyphosis. So kyphosis, it's your middle back. When you look at it from the side, you should obviously have that curve, which I mentioned earlier. So with Sherman's disease, that curve is quite increased. It can be from birth or it can be something that's developed over time. Usually, from my experience, it's from from young age. There can be lots of reasons for it. Worst case scenario, it can be because of some fractures. That's quite rare. I've only seen a few of those over the years I've been practicing. It can sometimes be linked to some chest deformities as well. So things like where the chest would have indentation in the middle. So for those medics, it's called pectus excavatum. So you should always check the chest cavity to make sure there's no kind of indentation in that, because that can sometimes cause some heart issues. But again, I would always recommend you see a spinal specialist and most likely have some X-rays taken to fully assess what the problem is. Because yeah, it is fixable most of the time. But again, most of the time it will be with the chiropractic adjustments and specific tailored exercises.
Okay.
Sorry. It can also sometimes be from a condition called ankylosing spondylitis.
Okay.
So basically, with that condition, you get a stiffening or calcification of the ligament in the front of the spine. And because of that, it then leads to that increased curve in the middle back. So that's from about 15 to 35 years old. There are some other symptoms you can look out for. Most commonly is just very stiff in the mornings, but a person can also sometimes get some heel pains and some dry, itchy eyes. So that's another thing that can be assessed for or picked up on X-rays.
Okay. Nalin, we can't hear you.
I was muted. Thank you for a wonderful and informative program, Dr. Xander. And
You're
I
welcome.
just wanted to know, that thing you said, it reminds us of the head
Your
is
posture.
twisted.
Yes.
What is it called? Would you be able to send us the name, please?
Yeah, just
While you're looking.
I'll just put it on the chat
Okay.
box.
Upright Go.
Yes.
Okay. Thank you so much. I've been through so many of these things that you're talking about. My back has what do you call it? Scoliosis. I had ankylosing spondylitis. All these I can remember now, through
I'm
the
sorry.
ages. But luckily, I did yoga. I started yoga 20 years ago, and I'm teaching it as well, right through till now. So hopefully, that is why I think that I don't feel the various aches and pains that another person would feel if they didn't do the exercises.
Well, that's fantastic. The quote I always think about is, your body is the only place you live, so take care of it. And obviously, good posture is one of those things that you should do to keep a healthy body.
Thank you so much.
Now, before I read another question from the chat, Jiten has a question for you. Are you
Hi.
there?
Hi. Yes, it's Jitin's wife. First of all, thank you. Thank you. It was a brilliant, brilliant lecture. It's so nice to hear everything, and of course, all your recommendations and everything. My question is, we as a family, of course, go to a chiropractor. My 6-year-old daughter, I've been taking her because she was born premature and with her neck and everything. So I've been taking her since she was like 5 months, and it's just like a maintenance and everything. We used to take her weekly, but now it's mostly on school holidays. What are your thoughts about her, from now starting with a care of spine and everything? What are your thoughts? Do you see children and going forward? I mean, just your thoughts, please.
Yeah, sure. So, babies and children, obviously, their body works exactly the same as ours, but they've got a spine as well. There's a big study that found that children who were raised under chiropractic were healthier than children not raised under chiropractic and were less likely to suffer from typical childhood illnesses. So typical childhood illnesses, for example, things like asthma, colic, hay fever, allergies, etc. Now, just for reference, a normal healthy delivery is an estimated 60 to 90 pounds of force, which goes through a baby's neck.
Okay.
So obviously a baby's not going to be able to tell you something's wrong. So, by the time they're then 5, 6, 7, 9 years old, etc., that could be one of the contributing factors for scoliosis, etc. In terms of babies and children, yeah, I've worked on a newborn. I've worked on a couple of days old, a couple of weeks old. My oldest patient is 103. So it's always good to grow healthy kids into healthy adults than try to fix broken adults because it takes a lot longer and a lot of commitment. And unfortunately, everyone wants and expects quick fixes. If you can do a weekly adjustment, fantastic, because up until the age of about 23, 24, 25, the brain is still developing. 90% of your brain's nutrition and stimulation comes from spinal movement. When chiropractors adjust your spine, is literally changing the babies and the child's in your brain. So the more, the better, basically.
Thank you. Thank you so much. Thank you for the reassurance. And
You're
thank you
welcome.
once again for the amazing lecture.
You're welcome. Anything else?
Yes, nerve impingement in which vertebrae of the neck causes arm pain, and what chiropractic treatment is appropriate in that case?
Well, it depends on which part of the arm. So the nerves in your spine control different areas of.
Sort of middle here,
So that will be usually C5.
outer side.
Yeah, so it's usually C5.
Like I can pinpoint, like this here
Yep.
and here.
Okay. Well, like I said, that's usually it's C5. So C5 is, from my experience, the most commonly affected disc in the neck that degenerates. And especially when you lose a curve in the neck, that's the one that degenerates first. So C5 nerve controls the area of skin where you were just showing.
Mm-hmm.
So what type of adjustment? Again, it depends on the assessment that obviously you should have with the chiropractor or with whoever. But it could be a manual adjustment. It could be using an instrument. But again, I can't say because obviously I don't know your case. So you have to have an assessment first. But based on what you said, it's usually going to be at C5 level of your
Mm-hmm.
neck.
Oh, okay. Thank you.
You're welcome.
Nadine, can I add something?
Yes, go ahead.
Hello, Dr. Xander. I just wanted to find out, I suffer with bad sciatica problem, and I've been doing lots of different yoga stretches, taking lots of painkillers. It's been over 3 years and still it hasn't made any difference. Can there be a complete cure or not?
Well, apart from the yoga, what else have you tried?
Nothing else, yoga and painkillers.
Okay, well, like I said, I would always suggest and recommend to see a chiropractor. Where do you live?
Berkhamsted.
What's your postcode?
HP4 2DA.
Okay. All I can suggest is I'll put in, there's, like I mentioned in the past, every registered chiropractor has to be registered on a regulatory body to be able to call themselves a chiropractor. So the website is called the General Chiropractic Council. So if you go on the website and then you can put in your postcode, so that's an easy way for you to be able to find obviously your nearest chiropractor. And yeah, you should just have an assessment with them. And if obviously if this is bad, if you haven't had any X-ray or MRI, that's probably something I'd recommend as well, so you can actually see the state of the spine and the disc, and if there's any disc bulges or stenosis or nerve impingement, and obviously at which level. Because then based on that information, obviously they'll be able to help you out and give you hopefully a course of plan or care to be able to help. Because what you have to remember with the painkillers, the painkiller is basically just blocking the signals to the brain. The problem, unfortunately, is still going to be there. Yoga is fantastic. Again, depending on the sciatica, there's always a few exercises you can do to help. So you can lie on your back and bring both knees up to your chest and hold that for about 5 seconds. You can do, since you're doing yoga, you can try to do a cobra slowly, because if you're getting the sciatica and it's basically potentially as a result of a disc issue, just remember, like we talked about last week, it's going to look something like this,
Yeah.
where the disc is getting compressed.
Yeah.
When you do the cobra, then it will take some stress off the nerve root. And then there's one more exercise. It's called the sciatic floss or sciatic nerve glide. So how you do that is basically just sit and then straighten out one leg, point your toes down, and at the same time look down. And then look up and bring your toes up at the same time. So that literally glides and flosses the sciatic nerve, and it's a very specific targeted exercise you can try.
What is it called? Sorry.
It's called a sciatic nerve glide or sciatic nerve floss. If you put it on, go on YouTube or Google, it will show you exactly how to do it. But again, like I said, you should have a thorough assessment by a chiropractor or by a medical profession, because I'll be able to give you specific targeted advice. These are just general exercises that I can recommend.
Yeah, what they say is there's a the disc is bulging out between L4 and L5.
How do you know that? Did you have an MRI?
Yes, yes.
Okay, when did you have the MRI?
Couple of years back.
Okay, well, then you should have a new one, just so you have a comparison at least to see if anything is better, anything is worse, or it's the same. And then, yes, or try chiropractic, and then also maybe try the IDD therapy as well.
IDD.
Yes.
Okay. Okay. So I can go through my GP for that?
No, that's private.
Okay.
Chiropractic is not on the NHS.
Okay. Okay.
If you have health insurance, most health providers do cover the cost for chiropractic. Obviously, you just have to check your coverage, because they will usually cover the cost of your initial assessment, any imaging costs. So if you have a new MRI, they would cover that or should cover that, and they should cover the cost of the sessions. But again, you need to check what your coverage is, because some of them have a cap. So, for example, £300 or £500, and then obviously use that for whatever amount of sessions you may need.
Okay. Yeah, we do have the coverage, so we'll have to find more. Yeah.
Okay.
Thanks a lot for your help. Thank you.
You're welcome. Good luck.
Bijal has a question for you. She suffers with scoliosis. Bijal? Bijal, are you there? I don't know if she's gone. Oh,
I can see her, but her microphone is muted.
yeah. She doesn't know how to unmute. Unmute yourself.
Is it?
There you.
Yeah.
You have a question.
Yeah, I've got scoliosis, and what can I do?
Well, when was the last time you had an X-ray for it? And what have
About
you?
3 months ago.
Okay. And who have you seen for it? Or what treatment have you had?
I've seen the GP. I've not seen anybody else. I'm waiting for the pain clinic, but they keep on canceling the appointments. So I was supposed to go tomorrow. Now I got message today that is cancelled up to 30th March. So
Okay, with the X-ray, which X-rays did they take for which areas? Your low back and your middle back, or was it the whole spine? And were you standing?
whole spine they took,
Okay.
and they said the it's going on one side all my, and it's so painful. I can't sit or can't do anything much. It's all moving on right hand side. It's right hand side is going like a numb. It's so painful.
With the X-rays, were you laying down or standing?
Standing.
Okay, that's fine. No, because sometimes when you have X-rays, you'll get them to lay down, but then that's going to be a problem because your spine relaxes when you're laying down.
Yeah,
So
no.
always do standing X-rays.
Yeah.
Like I said, the best thing I can say is to try and see a chiropractor, because with the scoliosis, first of all, you need to measure the angle of the curve. So do you know how much the angle of your curve is?
No, I don't know. They didn't tell me anything. I'm waiting for the specialist to see me as well, but
Okay,
it's
so
so difficult to get the appointment.
I know, so the angle, it's called the Cobb angle, which is COBB.
Yeah,
So you should ask them, what is the Cobb angle of my scoliosis? So that's a very important measurement.
Cobb angle.
Yes. And once you have that measurement, then obviously then you have a reference because that's something that they will use in the future because you should
Yeah.
have x-rays either every 6 months or every year to
Oh,
review it.
uh-huh.
But with the scoliosis, if usually it starts in the lower back. So if we use this as L4 and L5,
Yeah,
if basically L4 would do a tilt like this,
yeah.
then the whole spine in your low back will then curve towards, say, your left side, and then your upper back will curve towards your right side. So the Cobb angle is basically from the bottom of L4
Yeah.
and the bottom of the top joint, where your curve is going to curve the opposite direction. So that's the Cobb angle.
Okay.
So with the chiropractic adjustments, what they will do is basically we will work on that. We don't do much on the upper back because that's your body compensating for this issue.
Yeah.
So basically the adjustments will be to gradually get that joint more level and then to stabilize the muscles around it, work on the pelvis, and obviously go through specific strengthening exercises.
Okay. GP said it might be the operation, but he said he might have to go under the operation. Is it true?
If the Cobb angle is very high, so for example, something like 40 degrees plus, then that's sometimes something that they will consider with it's called Harrington rods. But again, I don't know if you need surgery because unfortunately I don't know your case. So first of all, get them to tell you what your Cobb angle is. Go and see either a chiropractor and then also see maybe a orthopedic consultant and get their opinion. Because with the pain clinic, all they're basically just doing is just managing pain. They're not going to do any kind of manual work for you. And even if they do, it's going to be, again, from my experience, fairly basic, unfortunately.
Yeah, yes, they referred me for the what is it called?
Physio.
Not physio, but for the hospital to go and see them. But I'm waiting for the appointment. It's very difficult to get the appointment.
I understand. Like I said, I would always recommend that if you can, just go and see someone privately, just for the time, because you can save yourself a lot of time.
Yeah. Okay. So if I go and see private chiropractor or something, it will be better.
Yes.
Okay. Thank you.
You're welcome.
Thank you very much.
So, Dr. Xander, can chiropractic care help correct posture permanently, or does it require lifestyle changes too?
Mm-hmm.
Unfortunately, there's not a permanent fix because your body is a dynamic structure. It's changing every single second. So it's not, unfortunately, you have chiropractic once and then you never have it again. It's the same principle as you brushing your teeth every day. So it has to be proactive, ongoing process. Now, the frequency of that, again, is depending on the person's goals and obviously how often they want to get adjusted, whether that be for improving posture or improving brain health, improving coordination, whatever it is. I get adjusted at least once a week because I know how important it is for me personally. I adjust my daughter, she's 11. I adjust her weekly because I know the importance for her as well. And I will plan to do that for the rest of her life until she says, I don't want it. Then I have to hold my hands up and say, well, I've done as much as I can. But yeah, generally, chiropractic is important
Yeah.
because, yes, it will improve your posture.
Mm.
And yes, there are other things that you should also do. So, yes, you should do specific exercises. You should maintain a healthy diet because if you're not eating enough protein, you can't grow healthy muscle. Your muscles need protein, and magnesium and potassium and things like that to function. So if you're not getting the right nutrients, your muscles don't function properly, which then also can cause or lead to postural changes. Stay hydrated. If you get dehydrated, again, your muscles contract. They don't work properly. Again, that can cause postural distortions. But again, if you're going to see a chiropractor, they will or should all be things that should be discussed with you throughout your care.
So, with children using tablets and laptops so much, what posture issues are you seeing in younger people today?
Well, the increase in the kyphosis, the middle back curve, but mainly rounded shoulders and forward head posture. One, if you have children, one, it's almost like a telltale sign, usually. If you look at the back of their neck, if there's a hunch in here, it's called a dowager's hunch.
Yeah.
So if they have that, then usually that's a telltale sign for that they've lost that natural curve in the neck, which is then a serious problem. So for those of you who have children, check obviously that part of their spine, get them to bend forward to touch their toes to see if there is one rib cage which is elevated. But yet try to limit and avoid screen time as much as possible. Because unfortunately, what is on the tablet or on the screen, you can't control unless you're physically sitting next to them. And obviously, the blue light is not good for the vision as well.
True. So, on average, how many hours a day do you think we should spend looking down at our phones? Not 24/7.
No. The other thing you also have to consider is whenever, if we're talking about phones and tablets and things, is what you're actually looking at. So if we talk about social media and, retail therapy, you go on Amazon, you go on whatever to look for something new, you trigger the release of a thing called dopamine in your brain.
Yeah.
So dopamine is like a pleasure hormone. But the problem is you keep stimulating and activating dopamine, you essentially become addicted to it.
Yeah.
And the more you use your phone, the more you addicted, and then basically you're stuck in a spiral. So there's a very good and a very important book that I recommend everyone should read. It's called The Dose Effect, DOSE. So D is dopamine, O is oxytocin, S is serotonin, which we talked about before, which is made in the gut, which the vagus nerve takes to the brain, which is your happy hormone. And then we have endorphins. So endorphins are also kind of like a pleasure, happy hormone or chemical. So when chiropractors adjust the spine, it releases and triggers the release of endorphins in the brain, which is why you feel so great after the adjustments. But the problem is if there's an imbalance in any of those chemicals in the brain and you're using phone continuously, then it is going to cause potentially some behavioral issues, etc. So if you have children and they have behavioral issues, get them off the screen as soon as possible because they could be potentially addicted to dopamine.
Yeah. So if anybody else has a question which are burning for you to speak? No? Then I shall say thank you very much, Dr. Xander, for such an informative and engaging presentation. We truly appreciate you taking the time and to share your knowledge and practical advice with our community. I'm sure everyone found the session very useful, especially the insights on how posture affects our overall health and the simple steps we can take in our daily lives to improve it. On behalf of GAA London, I would also like to thank everyone who joined us this evening and participated in the discussion. Your presence and interest in community health initiative make these sessions meaningful and worthwhile. So we hope that the information shared today will encourage all of us to be more mindful of our posture and take small but important steps towards better spinal health and well-being. So please do keep an eye out for our future community webinars and events. And we encourage you to share these sessions with families and friends so that more people can benefit. Once again, our sincere thanks to Dr. Xander and to all of you who for joining us this evening. Wishing everyone a wonderful evening ahead. Thank you and good night.
Thank you very much. Good night. Thank you.
Thank you, everyone. Good night.
Good
Thank you.
night,
Good
all.
night.
Take
All the
care.
best.
Thank you.
Thank you.
Thank you.
Good night.
Bye.
Bye.
Bye. Bye.